Welcome to another EduMed video. In this video, we'll be talking about Kawasaki disease and giving a brief overview of what it is, how it's diagnosed, and how it's treated. So, Kawasaki disease itself is an autoimmune condition. That means that the body creates antibodies against certain parts of its own organ systems, and therefore it causes a multi-organ disorder. It is acute. Thankfully, it's self-limited, and it affects the medium vessels. And these medium-sized vessels become inflamed, and it is effectively in vasculitis. The reason we worry about Kawasaki disease is that it can affect the coronary arteries, causing coronary aneurysms. And the majority of the morbidity and mortality relates to its cardiac consequences. So who gets it? Well, we really don't know very much about why certain patients get it and certain people don't. There's theories as to whether there's a viral or bacterial trigger, and some patients have a viral prodrome to developing the actual disease itself, but no causative agents have yet been found. There certainly is a genetic predisposition, and there's a couple of HLA subtypes that seem to be more prone to developing Kawasaki disease, but certainly no specific link has been found. It is true to say that siblings who develop Kawasaki disease are 20 times more likely for their other siblings to also develop it than when compared to the general population. And that probably again indicates that there might be some genotype predisposition to developing Kawasaki disease. However, of course, there's the confounder that siblings generally tend to be closer, be in contact with each other, and therefore may be at more risk of being exposed to whatever the causative agent or agents are to develop Kawasaki disease in the first place. Interestingly, about 40% of patients test positive for viral respiratory viruses at the time of a diagnosis of Kawasaki disease. Now, again, if you were to swab lots of people, depending upon the time of the year, many people probably will swab positive for respiratory viruses. So just finding that in and of itself isn't necessarily a link with Kawasaki disease, but it's interesting, and it seems to go with the fact that there might be some kind of viral or bacterial trigger for this disease. It's predominantly a disease of young children, and where we see it most is between 4 months old and 5 years. You do see it sometimes outside of this age range, but the vast majority are in the 4 month to 5 year old group. It has a slight preponderance towards males, but we're talking about 1.5 to 1 as a ratio. And this is a disease that's far more common in ethnic minorities, especially in the Asian subpopulation. So the Japanese and Chinese especially get quite significant numbers of Kawasaki disease compared to countries with Caucasians. It's really divided into 3 phases, the presentation of this disease. And it's quite useful to think of it in these 3 phases, because the earlier the treatment, the better. And if you can pick these patients up in the acute phase and start them on the appropriate treatment early, the chances of them developing the coronary complications which we worry about is much lower. The first stage is a fever that lasts for a couple of weeks, 1 to 2 weeks. These patients also present with a rash and conjunctivitis and potentially myocarditis and other serositis. In the next slide, we'll be going through the diagnostic criteria for diagnosing Kawasaki disease, and we'll go through all of those symptoms in a bit more detail. The second stage is the subacute stage, and this is really where the damage from Kawasaki disease is caused. This is usually 4 to 6 weeks from when the symptoms first start. There's desquamation of the hands and the feet, and this is where you get the dreaded coronary aneurysms. aneurysms. It is these coronary aneurysms that then can cause problems with myocardial infarctions, aneurysm ruptures and sudden death, pericarditis, and also potentially pericardial effusions secondary to a rupture of those, and again, sudden death. Following that subacute phase, then patients go on to a convalescent phase, and often after about 3 months from the onset of symptoms, patients are back to normal. Interestingly, after 8 weeks, the chances of new coronary aneurysms forming is much lower. And so it's trying to get these patients in the first few weeks up until the 8th week is really what's key to try and prevent coronary aneurysms. So the diagnostic criteria for Kawasaki disease is purely symptomatic. So it's a syndrome that we look for. So one of the key things is having a persistent fever. And these patients often have to have a fever for 5 days, and then 4 of the other features. These features include conjunctivitis, erythema of the mouth, the oropharynx, the stereotypical strawberry red tongue, and cracked red lips. They often have a rash that's quite prominent, and it can be macular and it can be papular. And they often have cervical lymphadenopathy. And this is what they look like. And you can see on the top here, the feet get erythematous, and then they can become quite red, inflamed, and then in the subacute phase, they start to desquamate, so all of the skin starts to slough off. This is the stereotypical strawberry red tongue. You can see there are little papillomas, and also you can see how red and inflamed it is. And just note how red, cracked, and inflamed the lips are. This is a typical presentation of a patient with Kawasaki disease. They can also develop these sorts of rashes that are both macular here, just the red, sort of slightly raised but flat erythematous regions, and then these little papules as well. And you can see in a little bit more detail here the hands, which can also become red, and you can maybe start to make out some desquamation there as well. The treatment is really to try and minimize coronary artery aneurysms, which the incidence of which peaks between 2 and 4 weeks, so early on in the disease. The treatment is actually remarkably effective at trying to reduce this, and that's why making the diagnosis early is important, because you don't have a lot of time to treat these patients if you think about the fact that you need 5 days of fever plus the other symptoms before you can even diagnose the condition. So having a high index of suspicion is important, even though it's a rare disease. The treatment is a combination of IVIG and aspirin. And the IVIG is 2 grams per kilo over 10 to 12 hours. And it's really important to try and start it as early as possible. And they suggest 7 days of the fever starting, because that can reduce the risk of coronary artery aneurysms from 1 in 4 down to just 3 to 5%. So a massive reduction if you can start it early. Along with the IVIG, they also start aspirin, which has some effects of antiplatelet effects, and that's useful. It's quite high doses of aspirin that they use, 80 milligrams per kilogram per day, up to 100 milligrams per kilogram per day, divided into 6 hourly doses. Do have to be careful with Ray's syndrome, which young children get with aspirin, which is why we tend to avoid aspirin in young children. And so if patients have things like, if they haven't had the influenza vaccine, it's important to give that to these patients, because it's when you give aspirin to children who have a concurrent influenza infection, that's where the chances of Ray's becomes much higher. Then the aspirin is tapered down once the patient has been free of fevers for at least 48 hours. And then that is continued on for 6 to 8 weeks, again to try and mitigate that time where patients are at highest risk of developing new coronary aneurysms. Some children can't have aspirin, and other alternatives such as clopidogrel and dipyridamole have been described in the literature. Some people suggest also adding in prednisolone, although to be honest there's not been any evidence that it improves outcome any more than IVIG and aspirin. So the prognosis is actually not too bad for most patients. Coronary aneurysms are the main morbidity and mortality for these patients. Patients between 6 months to 9 years seem to do the best. Those outside of that range tend to do quite poorly, but it's quite rare to get it outside of that range. The main complications are all pretty much cardiac. Some patients can develop heart failure, and that can be due to myocardial infarctions or myocarditis. They can also develop a valvulitis as well, which may increase the risk of valvular dysfunction and again developing heart failure. And the thing that everyone worries about is coronary artery ruptures, which effectively lead to death because it's very difficult then to treat that in a timely manner. So in summary, if you've got a child who comes in with a persistent fever of more than 5 days, think about Kawasaki disease. When you see these patients, they're pretty stereotypical. They look unwell, they've got that red cracked lips, they've got the erythematous hands and feet. They may not have all of those features, but often they look just really sick and you can't find an effective precipitant for them. Treatment is really important. That's why it's important to make this diagnosis, because a combination of IVIG and aspirin really does reduce the risk of developing coronary artery aneurysms. And it's interesting because there seems to be a link between COVID-19 and Kawasaki disease. Certainly in the UK there's been an alert by the NHS, as done by the Paediatric Intensive Care Society, to warn people that there's been an uptick in the number of Kawasaki disease presentations. We'll do a separate video looking at the evidence for that, because it is slightly tenuous, and the one may argue that this alert has been done a little bit too early, because we don't really have the evidence to suggest a link between the two. But it's certainly important for us to be vigilant of Kawasaki disease, especially because the treatment itself, if given in a timely manner, is so important in trying to prevent the cardiac complications of Kawasaki disease. So check out my next video. It's on the link between COVID disease and Kawasaki disease. And if you like this video, please press the subscribe button and hit the bell notification. You'll be updated of new videos as they're produced. Thank you very much.